Hello, I'm Melly Shansfeld, Managing Editor of Orthodontic Practice US, a MedMark publication. Welcome to a continuing education presentation and question and answer with Dr. Payam Ataii. In our webinar today, we will be discussing tips on identifying clear aligner patient-driven aesthetics and action plans to get a buy-in from potential patients. Before we get started, I would like to invite viewers to use the chat box on the right side of your screen to ask any questions, and your questions will be answered at the end of the session. Also associated with this presentation is a free CE quiz. Within 30 minutes after the end of the webinar, we will email all attendees the presentation replay along with instructions on how to access the CE quiz. Now I'm pleased to introduce our guest for today. Dr. Ataii obtained his Doctor of Dental Medicine degree from Tufts University School of Dental Medicine and completed his dental externship at Harvard School of Dental Medicine. Dr. Ataii has completed thousands of clear aligner cases and serves the dental community and patients as a speaker, expert witness, and practicing dentist. He is nationally recognized as a key opinion leader with multiple peer-reviewed publications and over 25 years of private practice. He has over 15 national media appearances where he has been interviewed on his expertise, and he has been published over 32 times. Dr. Ataii develops solutions to improve and simplify how comprehensive dentistry is delivered to patients. As a patent holder of an FDA-cleared oral device, he continues to innovate and invent dental health solutions that help dental practices reap the rewards of modern technology for their patients. He also serves on multiple dental and medical device company boards. Dr. Ataii, we turn the webinar over to you to learn more about our topic for today.
Thank you so much. What a great introduction. I actually want to hear what this guy's got to say. Doctors, team members, welcome. And it's always great to talk about my passion, which really is the clear aligners in how to turn consumer to patient and really understanding the mindset of what these consumers are thinking prior to you becoming your patients or walking into your practice. So 27 years of dental practice under my belt, over 3,600 cases. I have to understand where the consumer mindset and what's happening today in our market. We know the social media, we know the patients and consumer driven markets has now become a kind of a mindset of where these doctors and patients may not kind of click and understanding what the patients themselves want when it comes to clear aligners and aesthetics. We're going to actually talk about what drives more aesthetics and the doctor's point of view of what the doctor's thinking and what the patient's thinking, and how do we get and leverage to integrate in our practice a system, potentially a software that can help us communicate with patients, get the best reviews, and maybe even try to get our team to really be effective than trying to manage calls all day long, trying to get patients into our practice. So again, leveraging potentially what I like to call this hybrid aligner model into our practice to really upgrade and get those communication tools that we need. So with that, let's get started. And first, I always like to talk about what our main agenda is when we walk into our practice. We open the door, we walk into our practice, 8 in the morning. What's in the hygienist mindset? What's in the dental assistant's mindset and the doctor themselves? When you start to look at the team as a whole, it really becomes back and front office. There really isn't a connection at times. Well, successful practices have always been able to kind of connect the two together. How do you get the hygienist, dental assistant, and doctor to kind of drive the treatment plan and be able to coordinate to the treatment coordinator in getting the patient educated of what that need versus the patient's want, right? I want to get my teeth straight, but what's the real need? They have a huge cavity in the back. They may have wisdom teeth. They may have an oral health that's not up to par, periodontal issues prior to get their teeth nice and straight. So the need versus the want is important. Now, fast forward to today's market where the patients are constantly looking at the social media. Patients are constantly looking at their teeth and looking at their smile line. And what do you get? You get a patient who really has more needs and really has more wants, but sometimes financials get in the way. So we start talking about the treatment plan that gets altered in getting the patient to accept treatment for financials. And that's where we start to miss the ball. So let's talk about what's out there in the market today. When we start to see these patients who are coming in, we've got to change their perception that they're coming into your practice true The chief concern is aesthetics, but your job is to diagnose, treat, and potentially give them a treatment plan that they accept. We all know this, but how do you communicate before the patient comes in? Is there a way of having tools of texting or messaging these patients prior to them coming in? So the patient, we have to understand their mindset. They look at a photo of themselves, they don't like the space between their teeth, and the doctor says, yep, in order for me to close that space, I got to pull teeth back and they might bang against the lower opposing arch. And then at that point, you might get a posterior open bite. So it's not as simple as you think. So I can't just give you a price. Can you please come in so I can evaluate you? And that's where you may lose the patient, because then at that point, the patient says, wait a minute, just tell me how much it is over the phone, because I'm looking online and there's companies and services that are telling me how much it is. So we've got to look at the patient's mindset and what they're thinking. And it really becomes two opposite mindsets, from the doctor to patient mindset. So let's dig a little deeper into the patient's mindset. Well, actually, let's backtrack that. Let's go into the doctor's mindset first, because I know doctors, you guys are listening to very clean to what happens to the patient. But let's listen to what happens in your mind. You open the door, you're worried about payroll. You're worried about treatment versus the prescription of them accepting the treatment plans. The new patient acquisition of when they're coming in. Are we able to get, how many patients do we get? And what are we having to do today? What kind of process and procedures do we have to do today on a patient? And some of you ortho or GP practices, you know what I'm talking about when I start talking about a book full of patients and you're looking at the schedule saying, yeah, I can do it. But around noontime, you're starting to wear down. You ask the team, why are there so many patients? Then when there's no patients, you ask, why is there no patients? So we've got to get into the mindset of being able to help the team understand that the patient's coming in, and now diving into that mindset is key, because you have patients of three categories, at least in most private practices. They're either really accepting of what you have to say. They're always happy. Every treatment plan in front of them, they accept. And then you have patients who may be indifferent. They're not quite sure. Does my insurance cover it? I got to talk to my spouse about this treatment. I'm not quite sure to make a decision. And then you have those critical patients, those three categories of patients when it's critical. Those third options are the ones that we spend a lot of time on. They're the ones that want the biggest discount. They're the ones that give us the most headache about how the process and procedure is. And another office is doing it for this price, or they saw it online on this price. And we spend a lot of time convincing those patients to become part of our practice. And the reality is the two top ones are really the ones that potentially drive most practices. The ones that accept treatment and pay, we don't pay much attention to them. If you start to look at the statistics, a lot of times doctors spend a lot of time with these critical patients looking to give them the discounts or looking to give them a better fee to keep them in practice. And those are the ones that sometimes may create a lot more problems than you think in your practice. So for that, I usually tell doctors and team members, hone in on patients who are actually paying your fees and who like you without questioning every treatment plan and trying to get a break or a discount. Those are the ones that potentially have friends and family that are in the same mindset. So when you start to look at the two different mindsets, you now need to address the most obvious, because when it comes to communication, getting the patient into your practice, you can see that 97% of Americans own cell phone of some kind. 85% own a smartphone as of 2022. And keep this in mind, that these phones are what patients are communicating online reviews. You're talking about making appointments, and these customers are not patients yet. These are consumers. These are customers that are looking online, and they're really paying attention to what kind of reviews you're getting before coming in. Now, word of mouth has always been great, but how many times do you get word of mouth from a patient without checking the restaurant or even the doctor's reviews? So when you start to look at your consumer driven markets, you have to take into consideration that they're looking for rating and really the quality, quantity. And when you start to look at these reviews, I always say it's about the rating, but how many are you really getting? If you're getting one rating and you have only 5 reviews and you've been in practice 27 years, well, that's not good, right? And even though if they're 5 stars. So when you start to look at an algorithm of trying to get this information and you having to push this information over to your potential team, The answer is people even won't even pick up the phone if they don't recognize your number. So how are you going to talk to your patient or make an appointment if they've kind of looked online, called you, and if you don't have their information? So you have to have tools and processes that are able to capture that patient's information, so that way you can then at that point focus in on the caller needs, so you can address their wants, right? So if the caller doesn't leave a voicemail, that's 80% of them, they don't leave a voicemail. And 87% won't even pick up the phone if they don't recognize who it is. So you start to look at these robocalls. I'm sure all of you are getting these. 55% of calls, that's 26 billion in 2021, that were robocalls. So smartphone is great, but we have to know how to crack that code in getting into our patient so that our patient can trust us and can come over to us and refer patients to us using that smartphone in their hands, rather than just throwing us as not go to voicemail, go to voicemail. Let's go a little deeper in how you can actually get these three stages going in attracting patients, engaging with the patients, and retaining the patients. Attracting patients, the Google or any kind of reviews, Yelp reviews, those are all key. Having the dentist near me is a most important part of you popping up if you have a lot of reviews. Now, I had a hard time getting one of my team members to just sit there and ask patients for reviews, or ask patients, and you can't incentivize these patients, you can't pay them for reviews, but the reality, it comes out like you're bribing them. But the reality is a lot of patients don't even do it unless if there's some sort of system. I'm sure a lot of you have experienced, you've gone to a restaurant and say, hey, rate us, and automatically you rate them because you had such a great feeling, whether it's good or bad. But do you want that rating to go live? What if that rating could kind of be visible, and if it's maybe 5 or more goes live, or maybe you set 4 or more? The reality is you can now have a processes that kind of filters before it goes publicly live, and that could be a product that you can have in your practice. And now you can even have where you're engaging the patients. Now they've come in, they've done the treatment, you can actually have them where they're making payments on their phone, and that easy seamless process, rather than for them to check out in front of your counter and maybe go over the treatment plan that they might have missed, because you can simply have that patient retention by these three steps of the thank you for visiting, why don't you rate us, let us know how it is, and the patient's ease of flow into that process. They now go from being consumer to a patient. So now let's talk about how we bring the two together. How do we bring the actual consumer, patient, standard of care in dentistry, and obviously my passion of aligners? So when you start to look at what the doctors see, a lot of times the doctors are seeing, as I show you on a picture up right here, you've got a silver filling in the back, no problem. You've got a little bit of canted, your bicuspids look like they've been, potentially missing or extracted. Guess what the patient wants? The patient wants whiter teeth. The doctor then has to now switch gears, forget about the fact that the patient is chipping the incisal, forget about the fact that the patient potentially has issues, and go into, okay, I'll give you white teeth. How do I now change that dialogue from a cosmetic to potentially a functional? Well, real simply, I will see what's happening to you. Your teeth are starting to get chipping, wearing, grinding. And this in time, 5, 10, 15, 20 years from now, could potentially get worse. Why not us put teeth in better alignment? And at the same time, we can add whitening for you, get you some whitening gels, and we're just going to make your smile a little nicer. That's one option. The other option is no problem. Here's some bleaching gel. Have a nice day. But the reality is, most of these patients, when you start to look at their scenario, where in this particular case, he's had a bicuspid extraction and he just wanted to stop the teeth from shifting, and he only wanted a retainer. The question is, well, maybe we can potentially do a better job than just a retainer. I know I can't give you a best function because your teeth you had a bicuspid extraction, they're relapsing, but maybe we can make it a little better. And then the cost gets in the middle of the way, right? Oh, it's $5,000 or $6,000. The patient's like, no. I came in for whitening. I went in for whitening and they tried to sell me $5,000, $6,000 worth of work. So now maybe we can have an alternative option of potentially having these patients to have other aligner treatments done where it's not just inexpensive, but just for aesthetics. So now you got the aesthetics and function go hand in hand. How does that work? Simple, because when you start to look at these patients where they've had the relapse of the lower crowding, you can see this particular patient, his lower teeth have been crowded and overlapping. So what do we need to do? Upright the teeth, maybe kind of put the teeth back to where he was when he had this ortho. Well, could that be done inexpensively? And that's the conversation that we can have with the patient. We can say, look, there are options for you, patient, that you can have. In what we've done, it's called introduce the hybrid system, where now we can have a hybrid scenario where we can have a third party maybe do the aligners. We can then help you with remove some of those restorative teeth that may be not an ideal, they could be cavities underneath them. And give you an inexpensive approach to aesthetics. And that patient now gets both scenarios addressed, because there are companies that will take these patients and send them to your practice. And how are you going to treat that? Well, you're going to have to treat them with potentially giving them some sort of a treatment plan or option. And in this particular case, it was great to have a partnership with a partner network type system where they can at least have the aligner system done. I've got my software that's engaging with the patient, from the texting to telephone, being able to talk and communicate to the patient. And these patients leave me great reviews. And then I continue that cycle again and again and again. So when you start to look at these patients, the standard of care, the legal definition is really what would you do as a prudent practitioner under similar circumstances in solving that patient's problem. And keep in mind, prudent practitioner means what? You're following the directives of your training, right? If you're a general practitioner, if you're an orthodontist, that's your real processes. So if a patient comes in wanting a treatment, but there are other options that those teeth are degrading, we have to give them an option and not put financials in front of it, but rather let the patient choose. So the dentistry itself has that treatment diagnostics and methods that you're going to help not just correct malposition of teeth, but also gums, jaw, associated structure, making sure that the patient really is in great oral health. And that's what our jobs are. So why I bring this subject to you is because a lot of times when we bring a new concept or a new plan or a new product into our practice, there's a lot of resistance with the staff or with the team members. And we kind of want to always make sure that at least the staff and team members are on board, right? So let's talk about educating at least the staff and team members. And I know some of you doctors may already know, it's just about the approach of what clear aligners can do and what type of clear aligners would be ideal for what type of cases. You have your simple case, your moderate case, your advanced case, and there's multiple companies giving you these different types of options. But more importantly, how do we get that clinical where within 30 seconds or less, we can kind of address the patient's at least concern over the phone or potentially over a text and get them into the practice so the doctor can give them a true diagnostic tool, right? So let's talk a little bit more about concepts or clear aligner tooth movement concepts. And this is much different. It's just a basic watered down version for some of you who may not know, is that aligner treatment is really tipping, expanding, and proclining. It's not necessarily doing a linear movement or translated movements where you're seeing wire and brackets, but the root apex typically stays in one position at times, and you get to procline or expand. And by doing that, you're able to give a lot of movement from molar to bicuspid to incisor, creating a better arch, creating a better oral class of getting that bite, what I like to cuss the fossa, or what we used to do in our denture setups, putting the teeth over the lower arch, putting the teeth on the ridge, and allowing the ideal, tooth to bone ratio. However, you have class 1, class 2, class 3 bites. So let's talk about what the aligners are able to do. The aligners are able to push, pull back, tip, and expand, right? Posterior teeth, I know we can get expansion of 2 millimeters from bicuspid to molar predictably very easily. Can you do more? Absolutely. But you may need some attachments, now engagers, or maybe some sort of a rubber banding. So just proclining anterior teeth and uprighting posterior teeth will give you where you have almost 4 millimeters of expansion on the posterior teeth and 4 millimeters of proclination, or if you want to tip teeth back, 4 millimeters back. From that, now you start to look at the posterior versus the anterior, right? So can you expand posterior arch? Yes, 4 millimeters. Can you expand or procline anterior arch? Yes, 4 millimeters. That's quite a lot on unraveling some of these crowded teeth. Or if you have patients who've got spacing, you can bring the spacing back and close up any 4 millimeters or less, which is considered somewhat of a simple case. At times, if you've got greater than 4 millimeters of overlapping, you have to do what's called interproximation. You need time, space, and pressure to move teeth. Well, that space is created by either you do a bicuspid at times extraction. I'm not a big fan of those yet. Or you can do some interproximation, as I call putting the teeth on a diet. And that interproximation will give you the room if you have greater than 4 millimeters of overlapping of teeth. So when you start to look at these overlappings, we can do what? We can expand the posterior arch, procline the anterior arch, and this kind of allows us to move teeth into a position where you can see before on your left side screen to after without really having to do much of an interproximation IPR. That's about 4 millimeters of just getting the root where it's at and proclining the anterior crown forward. This typically are patients that you see that are considered simple or mild type of cases. When you start to see overlapping laterals, how do we resolve this narrow looking upper arch? Well, the way to resolve that is exactly as I said. If you expand the bicuspid and molars on the posterior, both upper and lower arch, right? And you procline forward the lower anterior and upper anterior arch, you're going to get yourself where, again, you don't need much of an interproximation. And what happens if you don't IPR? You get somewhat of a black triangle. So you sometimes doctors like to add it so they don't have an overjet. Again, I'm just giving you the basic concept. So when a patient comes in, if they have less than 4 millimeters overlapping of spacing or crowding, those patients would be ideal for a simple or moderate type case or aligner system. So looking at these patients, this particular patient's got greater than 4 millimeters of crowding. So you can see that just the overlapping of the lateral incisor to the canine, just taking a perioprobe and measuring how many millimeters, that's over 3 millimeters of overlapping just on that lateral. And you have another few millimeters on the lower. So you've got almost 6 to 8 millimeters of crowding. In this case, you would need to do, even if you expand the posterior arch, as you can see, there's been some uprighting that's happened, you still need to do some interproximation. That you can see in your photo and in the image on the lower right of your screen that looks like it's been kind of shaved in between, that it has gone through. So again, simple to moderate cases don't really need attachments or any kind of real interproximation, and they're about 4 millimeters or less. Well, take a guess how many people in your practice right now, out of 10 patients, how many of them will have potentially simple to moderate cases? Right? We know that there's going to be a lot of crowding and spacing cases. Out of 10, we'll probably have 8 or 9 patients who have malocclusions. How many of them are considered simple? That really leaves us in the shallow end of the pool, about maybe 2 or 3. And that's how many patients that can benefit, which I call from a hybrid aligner system. And it is multiple companies, specifically one that's allowing patients do that and help them remotely get these treatments done, as well as how do you communicate with this patient once they leave your office to come back for potential recalls and hygiene. Again, following up with a communication tool and system. So 3 out of 10 patients typically have cases that are considered simple or moderate with aligners, right? Now, when you get to the next level of looking at some of these additional cases, we can actually go and take this 4 millimeter to a little bit more of a deeper dive. So let's take a look. This particular patient has an overjet on the lower anterior. And if you look, its upper arch is kind of underjet. So the patient's got an edge-to-edge anterior bite and somewhat of a cross bite on the posterior. And by definition, this case, just looking at it, looks like it's advanced. But I want to break it down for you. What if we were able to take that 2 millimeters on each side on the posterior, upright the posterior, and as we talked about proclining the upper anterior, the 4 millimeters, would we be able to get that tooth expanded? And so when I look at this particular case, I'm looking at it, getting some expansions on the upper arch, unraveling lower crowding. And that would potentially give us where the patient can get somewhat edge to edge. So again, let's go back and look at the patient before. And as you start to look, as we kind of expanding the posterior arch at 2 millimeters, you get an edge to edge bite. We're now going to start inclining the anterior teeth forward. And now you get the patient somewhat edge to edge. And now you can maybe add lower anterior IPR or maybe some lower arch IPR to bring the lower arch back, and now the upper drops right in. These kinds of cases are considered still a little bit on the moderate end, but cases that the patient can get that expansion and proclination of that 4 millimeters or less, right? Because if you're proclining out and expanding out, you put that upper arch over the lower arch. So it's good to kind of get an idea that you're able to see these cases really in real life, to go through of the aligner movements that are very predictable and very much possible given the patient's compliance. And when you start to look at patient compliance, how are you going to communicate, hey patient, are you wearing your aligners? You're going to text them from your phone. You're going to text them from the office. And I've seen a lot of offices have these text messaging phones that they bought just for the practice. But now somebody in the office has to kind of, push the lever and do all that. So for me, I like the process of automation to gain these patients' trust and to find out how they're doing. And they become the ones that give you the best reviews and constantly send you friends or family. So how many dentists have seen these patients of what I call the obvious, where the patient has spaces between their teeth, or in the previous patients they had, and they kind of given them a little bit of not a processes that's easy for them, or even patients who've got the worn down teeth, who've got the overlapping of teeth. I mean, again, out of 10 patients, 8 or 9 of these patients are maloccluded. Maybe 2 or 3 have somewhat of an overlap. But when you start to look at these patients, you can't ignore that you've got to give them at least a treatment plan or a treatment option so that you are in compliance with just standard of care, as well as kind of meeting the patient's wants. So it's a delicate balance, it's a very delicate balance. And now I'd like to kind of get into the benefits of how we can use the clear alignment therapy and what options these patients have with aligner products. Okay. So when you start to look at some of the benefits, we know that aligners can correct excessive spacing, crowding. I mean, these result in food impaction. They lead to periodontal issues, biofilm form. I mean, how many times are you going to clean or clean or deep clean the patient every 3 months? Bring them in for a deep cleaning. It doesn't make sense. Sometimes patients who've got straighter teeth don't get as much food impact. We know that aligners can treat those traumatic occlusion and malocclusions. We talked about those abfractions and excessive wear by placing the dentition in a more ideal position. Patients can benefit from a stable and functional bite or occlusion. We know that there's really an alternative to a restorative of doing veneers for cosmetic cases. We at least preserve enamel. We don't want to patient has that concern of not having an ideal smile. Great. Maybe we can give them the veneer or restorative option, but maybe an orthodontic clear aligner treatment plan might work. And it's really easy to keep their oral health, and it actually improves their oral health. Patients who are on aligner therapy tend to care more and more about their restorative and their teeth. And you start to see these patients from a hygiene, and the hygiene chair becomes key in potentially educating these patients of why they would need this type of treatment. And it really motivates these patients in the hygiene chair, in my opinion. And to me, it's a soft tissue management tool, really, because periodontal treatment sometimes are not just because the patient's ignoring their health, but rather it's because, again, of the malocclusions or the crowding or overlapping or the bad bites that we see. And I always say the byproduct of a good smile is a byproduct of a good bite is a nice smile. So again, byproduct of a good bite, nice smile, patients are happy. So you look at the overlapping incisors that they talk about, and the periodontal community knows that this is directly related to gingivitis. And you look at the effects of oral health. How many of these patients are out there? Well, think about it. 65% of patients in the US population have misaligned mandibular incisors, right? 65%. That's And I will tell you, in my office, I think it's a lot higher because it all depends what you're classifying as misalignment. But when you start to look at the patients, that's again, you're talking potentially having a lot of patients who got this situation. And we need to add processes in our practice, maybe remotely talking to patients, but having that tool or device to communicate. Teledentistry was on a rise in a few years ago. Again, just because of the pandemic, we kind of noticed there's an alternative way to communicate with patients. So it's important for us to have tools to try to remotely talk to patients. At the same time, a lot of them don't want to come in because you have the processes where you can actually treat patients. And teledentistry is now accepted and has been accepted by ADA. We just didn't know how to bill for it, right? So a lot of you doctors, I know some of you already know, but in my practice, I like my phone, my computer, my mobile app. I like it to be all part of one component. And it's important because when the patient calls, I want that patient to be captured. As soon as the patient calls, we know who that patient is, what their information is. Did they miss a schedule? Did they miss a cleaning? Did they miss their last ortho or aligner appointment? And all of this should be in sync from the mobile admin portal of whatever practice software you're using, as well as desktop. That's been the most key successful tool in my practice. Again, going back because 90% of people now they say they prefer texting over actually calling. And you start to read that patients, 95% of them, they read their text messages. And you're talking, they rather do that and they'll look at SMS marketing than those robocalls, right? So when you start to look at these processes and you look at clear aligners, the two have to come together. So how was I able to merge the two together? Well, I picked a aligner company partner as well as I picked a communication tool partner. I'm open to all aligner companies in my practice, and I can name you from the Invisalign plan, from the ClearCorrect brand, including Smile Direct, where they're actually able to Smile Direct do remote treatment for those minor and simple cases, to telecommunications of Weave. And they've been great in giving my practice tools to kind of communicate with patients. And more importantly, when you start to look at the aligner market, I mean, this is becoming where from 2003 when I started, where the patients did not understand aligners, doctors didn't think plastic aligners are going to work, to now you start to see that in 2028, you're talking that the revenue is hitting $1 trillion dollars in the market. Well, this is the growth that we see in the aligner practice growth opportunity. So we've got to have the two where you start to look at these brands in the market. These brands all market to patients, talk to patients. Patients walk to our practice. They sometimes want this product. And now we missed the ball in trying to communicate with them because we didn't capture their phone. We didn't capture their name. They came and called us and they wanted the price. We couldn't give them a price. We were trying to get them to come in and they hung up. We tried asking them for their phone and their cell phone number and their email. Too much. All that can be done by third party because you have to have confidence in your practice of what you're bringing into your practice, may it be from aligners to telecommunications. And more importantly, you have to be able to talk about these different types of products. For instance, I have what I tell patients, look, all the plastics are the same. I have no bias towards any company. However, should you want a hassle-free process, should you want to have a process where they treat the cases that are, those simple to moderate cases, we can give you an affordable process. And they have technology that helps with the aligners. We can actually, help you with that process. We will actually communicate with you through our tools that are given to us. And the patient confidence then shows that we're able to give them all different types of brands, not just one. We're not just pushing them towards our agenda of what's a product in our practice, but rather giving the patient that confidence that whichever brand that they saw, we're able to promote and provide for them. So the awareness, however, in the GP and ortho market is starting to grow, but it's really down to a few aligner companies. And that always comes back in brand awareness and support. What kind of support are you going to get? And what's the business tools that you're going to get? Because for me, when you look at the communication tools, that's sometimes dollars that you spend trying to communicate with patients, trying to attract them, retain them, and then you have to constantly be engaged with them. You know, having them text you that they missed their appointment. Well, yeah, but I don't want to have my front office keep texting the patients as to your next hygiene appointment. That's too much work. I need the automation. And again, I've been very happy with having Weave in my practice, that they've been actually one of the key folks that helped me grow, without exaggeration, the past 7 years I've had them, my practice, to a point where everything's pretty much automated. Every 6 months, I know that this patient's going to be getting a hygiene recall text. I see that they're getting a lot of information from their insurance. They're actually able to pay for their treatment. Some of them come in already knowing what they have to pay, and simply with the click of a button, their credit card gets charged. And it's very easy process. I call it the Tesla experience in my practice that I want to create for my patients. And that's what I've been able to get and gain by simply starting with the manufacturer of different company of aligners, understanding aligner therapy, being an option where there's a teledentistry option in my practice for aligners for the simple to moderate cases, having that communication tool that's being now text and emailed, as well as any kind of processes that patients want or seen, I'm able to provide for them. So with that, I know that we always want to take some questions from the audience and from you. So if there's any of you that want to have those information or additional questions, I'd be more than happy to accommodate.
Thank you, Dr. Ataii. There are some questions coming in, but before I get to those, I would like again to invite viewers to use the chat box on the right side of your screen to ask any questions that you have. Our first question coming in is, how involved in the creation of marketing assets for your office are you?
Yeah, you know, hard. You try to be involved in marketing and being a dentist, running a practice, doing payroll, bookkeeping, et cetera, et cetera. I just like to kind of say, let's get this kind of production. How do we get there? So I team with a proper company. Again, I talked about having text and messaging that really helps these processes simpler. If I want to send a text saying, hey, we have a summer event. Anyone who wants to come into our practice, we include whitening for clear aligners, or you want to get a straighter teeth with a straighter smile, we'll whiten them at no extra charge. I can do that via text or message very simply and push that out, even a small flyer, much easier than me having to create it, me being behind it. Again, partnering with a third party that helps your practice grow, that is key. And that's what I've been talking about. And I think I mentioned Weave as one of the companies that's really helped me do that.
Okay, second question. What is your advice for doctors who want to get involved with aligners? How do you start?
Well, first and foremost, you got to know some basic movements. I'd always advise just to, I mean, I gave you a brief understanding of plastic aligner movements. There's a lot of aligner courses now, and a lot of companies provide their own education. You know, for me, again, coming from a aligner background when it was Invisalign when we first started, moving to Clear Correct, understanding their concepts, and going into Sure Smile and understanding their products and Dentsply products, and now with Smile Direct Club, that I see that they have telehealth and telemedicine processes with this simple and moderate cases. You know, you're gonna have to be multiple companies and do your homework. They have their own educational platform and processes. For me, the access to care for patients who want to have a simple process, at home process, and there's again through remote type of a treatment. Those are, I really prefer Smile Direct Club. They've done a great job. I know they don't have a great name in the market, but that's good dentists worry about potentially them cannibalizing their business, which is not the case. I mean, they have a partner network where they send patients, and as well you can send patients to your to them. You know, Invisalign's done a great job, as well as ClearCorrect with their educational platforms. So there's a lot of companies that when you partner with them, they'll help you kind of get to that one or two simple cases. And you have to start someday.
What specific messages have worked well in marketing clear aligners to your patients?
You know, being clear is the best, right? No pun intended. Being clear is, I'm not a fan of trying to do pricing. I'm not a fan of you try to beat the pricing. I'm a fan of putting a before and after of some aesthetically where the laterals kind of overlapping, and you just kind of put a simple before and after and say, do you want this smile today? Right? I'm a big fan of just letting the patient's imagination, their wants, take over the needs, so I can give them a treatment plan. So for me, images and before and afters are the best.
How are you measuring the impact of marketing pieces? Do you have a separate phone number you track?
Yeah. So again, partnering with that third party company really helps because they'll give you tracking. They'll show you, what kind of requests are coming in. And these are basically software apps that's part of my, I get my phone services, I get my app, I get my texting. All of that is done through one company. Again, I've mentioned to you several times that Weave company has all of these tapped into one. When the phone, as soon as the patient calls, pops on my software. I get to see who the patient's calling. As I mentioned, I get to see if there's any missed appointments, if there's any last time they were here, even if there's a balance due, or if it's a new patient. So these types of products all need to be connected, and then you get to see what number worked for you, what ad worked for you, and these are the kind of tracking information that you get from partnering with the right third-party communication tool.
Okay, we have room for one more question. Do you have an aligner preference?
Do I have an aligner preference? Well, look, I can't say all plastics are the same because, pretty much what happens is I've seen that the torque is mostly the same. The movements of 0.25 or 0.3 millimeters of movements are the same. There's been multiple different plastics in the market that I can kind of say I've had experience with. Again, I mentioned multiple companies. I'm a big fan of patient comfort. Not a big fan of a lot of approximation or attachments. So patient comfort is key. And the plastic that has been providing that, I would say, is pretty much all companies. That's what their goal is, patient comfort. The question is, how easy is that process for you to start as a clinician, providing some sort of at least dialogue to your patients? And again, I would say my preference currently, I have Spark. I use them a lot. I've been using and tiptoeing with Sure Smile, and obviously Smile Direct Club is my go-to for remote access to care for these patients who come in to have mild and simple cases.
Okay, well, we're running out of time, but we thank everyone for your questions. And if we did not get to your question, we will answer it after the webinar via email. In the next 30 minutes, we will send you a link to a replay of the presentation and instructions on how to access the CE quiz. Please be sure to complete the free CE quiz associated with this webinar to receive your continuing education credit. Thank you all for attending, and a special thank you to Dr. Ataii and our sponsor for this webinar, Weave. Thank you, and stay safe out there.
Thank you for having me.